breath.
Chronic kidney disease rarely claims the spotlight, but this dangerous condition is nearly as common as diabetes.
Chronic kidney disease affects somewhere between 5 and 10% of the adult population in the U.S.
The kidneys are a pair of bean-shaped organs near the middle of the back. Their main task is to cleanse the blood of waste that would otherwise build up and damage the body. In people with chronic kidney disease, the kidneys slowly lose this ability, often with no warning signs.
How are you, Mr. Brackens?
I'm fine.
Good to see you.
Good to see you, Doc.
54-year-old Robert Brackens didn't know anything was wrong with his kidneys until he ended up in the ER with kidney failure. Now he depends on dialysis, a machine that does the kidney's job of filtering the blood.
I was diagnosed with chronic kidney disease about 8 months ago, and it was quite surprising to me. I mean, it was unexpected.
The kidney function can be significantly impaired without any symptoms whatsoever, except perhaps an elevation in blood pressure, or perhaps a little bit of swelling of the legs or swelling around the eyes. If that kidney disease progresses, then more and more problems can accrue, including cardiovascular events like heart attacks, heart failure, and stroke, and ultimately progressive kidney disease and kidney failure.
In most cases, these devastating complications can be avoided through early diagnosis and treatment. The National Kidney Foundation offers free screening for people who may be at risk.
It's a very targeted screening process, so it's for people who have diabetes, people who have hypertension, and also people who have a family member who has kidney disease, because that also makes you at risk.
Well, by far the most important cause of chronic kidney disease in the United States is diabetes, particularly adult onset or type 2 diabetes. Other potential causes of kidney disease include high blood pressure.
I had high blood pressure, and I was taking blood pressure medication.
African Americans and Hispanics and other minority groups are at higher risk for developing chronic kidney disease.
These groups are also more likely to have their kidney disease progress to kidney failure. But there are ways to slow or even prevent this progression.
There are now several classes of medications that have been used to specifically slow chronic kidney disease above and beyond the benefit we can afford patients with better control of hypertension and diabetes.
Unfortunately, many patients don't know they have kidney disease, so they're missing out on treatment.
There are 20 million people in the U.S. with chronic kidney disease, and there are another 20 million more at risk. So our hope is that we can find people who are at risk, encourage them to go get tested, and to understand and consider the various treatment options that will allow them to live full, happy, productive lives with chronic kidney disease.